Okay, so ye whatever you can see right now, right? Whatever you can see right now in front of you. Yeah. So whatever you can see right now in front of you from the skull, these are going to be the facial bones, and as I said, only the jaw is going to be capable of moving, right? This you already know, right? Now see beta, when you talk about the axial skeleton, I had told you that we have got two types of skeleton, axial and appendicular. So ये जो आपको दिखाई दे रहा है, this is the axial skeleton. Okay, so this is going to be the cranium. These are the facial bones. Of course, you can see the shoulder bone है ना यहाँ पर, जिसको हम pectoral girdle के नाम से जानते हैं. This will be called as pectoral girdle. Okay, you can see this. We are going to go into the details of all of them. ये scalpel कहलाएगा and all. You know, I'll talk about it. This is going to be the rib cage. This is the rib cage, as you can see very clearly, right? Then ये जो lower portion है, this thing, this is going to be the pelvic girdle. Okay, so this is going to be the pelvic girdle. So this is how you know your axial skeleton is going to be made up of. Fine. अब इसके बाजू में, of course, है थैली में रखे इसके हाथ पैर मैंने. So the limbs, associated limbs will come under appendicular skeleton. ठीक है? Here you can see from the back side, you can see the very clearly you can see the vertebral columns. अच्छी तरह से दिख रहे. फिलहाल इनको मैं रख देती हूँ. I bring him back whenever we want to talk about it. अच्छा, just look at this बेटा. ये जो ribs है ना, so this is going to be the sternum. You can see. ये देखो. This is the sternum, which is called as the breastbone. Right? This is going to be the xiphoid process. जिधर अभी मेरा फिलहाल my finger ना, you can see here is the xiphoid process. Okay, and you can see all of them, all the ribs together very clearly in this. Right? फिलहाल I'll keep him aside, and whenever required, of course, I'll bring him back. मेरे बाजू वाले चेयर में ही बिठाती हूँ. फ्रेंड है मेरा भाई, नीचे कैसे बिठाऊँ? I'll make him sit here. Him or her, whatever. बैठ जाएगा. So we go ahead with the description. As and when required, I'll bring him back. It's not real. How does it matter if it is real or not real? No, it's not real, Baba. It's going to be made up of POP. Okay? Plaster of Paris से बनते हैं ये, जो मिलते हैं हमें. Well, so yes, Aditi, you're right. You're right, Bida. You're right. Yes. Shwet, कुछ भी. Okay. So facial bones पे आते हैं. Last class we had talked about the skeleton का brain के बारे में हमने cranium के बारे में बताया था, right? So let us talk about the facial bones now. Okay, I'll just give a quick recap to this so that now you know. I don't know if you would be able to see the fine lines on his cranium, and I'll just try to show you. Okay, as you can see, this particular thing and this one is the same now. Sideways आपको दिखाई दे रहा है, right? So this is going to be the frontal portion. ये जो है, this thing is going to be the frontal. Can you see the fine lines? I'm really not sure if you can see the fine lines. Just try to get my. ये देखो, ये ऐसे sideways तुम्हें fine lines दिखाई दे रही है कि नहीं? I'm not sure. Anyways, so this is going to be the frontal portion, as you can see very clearly. right? Here sideways, this side and this side, right, is going to be the parietal one. Okay, fine. इधर पीछे की तरफ occipital bone, and this portion, you can see this portion which is going in, you can see my finger going in. This is going to be the occipital condyle, which is going to be resting on this vertebrae. ये जो है यहाँ पर ये vertebrae है. So this is the vertebral column, right? So this is going to be the vertebrae. Now, of course, I can't remove each and every vertebrae when it is going to be, like a physical lecture. I'll try to get it. If possible, I'll definitely get it for you all. So यहाँ पर ये जो first vertebrae है ये थोड़ा सा अलग दिखता है और ये दूसरा vertebrae भी थोड़ा सा अलग दिखता है. बाकी सारे same दिखते हैं. I'll talk about it in detail. Okay. Then here you can see this is the movable jaw. You can see it is moving very clearly. Correct. Then in the diagram you can see. So this is of course the mandible. This is the maxillae. ये जो है इधर maxillae है. Right. Inside there is going to be here. ये eye socket है ethmoid का. You can see the ethmoid वाला very clearly. And you can see this zygomatic processes, cheekbones बोलते हैं हम लोग इसको. So these two are the cheekbones, right? Correct? Fine. Sphenoid यहाँ पर होता है इसके अंदर sphenoid bone. Ethmoid is here. Lacrimal is here. Nasal you can see over here. Nasal. Right? Yeah. So this is how the entire, our the cranium is going to be associated. Correct? Well, so we had talked about this in the last class. Now we'll go ahead with the facial bones. So the facial bones are going to be 14 in number. So 14 facial bones give characteristic shape to the face. Growth of face stops at the age of 16. So I think all of you all have entered the sweet 16 phase. And so now the facial growth is going to stop. So जो भी nose का shape है, आपके cheek bones का shape है, eye orbits का shape है, chin का shape है, is going to remain like this only now. Okay. So facial bones are as under. We have got paired bones which form the bridge of the nose. 2. Maxillae, upper jaw bones, which are paired bones that join with all facial bones except the mandible. So maxillae don't pair with mandible. Mandible is movable as I showed you just now. Upper row of teeth are lodged in the maxillae. So ये जो अपना पूरा region है, that is of course going to be the maxillae. Palatines, paired bones form the roof of the buccal cavity or floor of the nasal cavity. So here you can see again. I don't know if you will be able to see this or not. यहाँ पर जो होता है ऊपर की तरफ, okay, that is going to be called as the palatine. तो ये जो palatine होता है ना, it is going to be the nasal का floor, okay, या basal roof of the buccal and floor of the nasal. तो ये buccal cavity है अपना पूरा, हाँ. तो इसके अंदर, I don't know really how to arrange the camera, but I think so now you can see I have made him actually, open his mouth. So ये जो point है, here where my finger is touching is going to be the palatines. ठीक है? Got it? Okay. Then we have got something which is going to be called as the zygomatic bones, which are nothing but the cheek bones, which I showed you just now. Lacrimal bones, which are smallest of the bones present in the eye sockets. Lacrimal bones. The bones form the medial wall of each orbit. They have lacrimal fossa that houses lacrimal sacs. Lacrimal sacs are nothing but they're going to have the lacrimal glands, which are also called as tear glands, right? The sacs gather tears and send them to the nasal cavity. So sometimes, you know what, when you're feeling bad, you're feeling sad, you're feeling low, you may not be crying actually, you know, the tears are not drooling from your eyes, but you start, you know, actually giving out tears via your nose. तो नाक में से पानी आने लगता है कभी कभी, बहुत मतलब दुख में हो तो, है ना, या फिर कुछ बहुत ज्यादा तीखा लगता है ना, तो हम बोलते हैं ना आंख नाक में से पानी आया, वो पानी सेम है, those are the tears only, but they will be sent to the nasal cavity, है ना, for discharging them. So maybe not from the eyes, maybe, you know, like you don't want to show that you are crying, so your eyes are not going to be showing that you're crying, but your nose does. Well, so that is going to be your lacrimal bones. Inferior nasal conchae, they form part of lateral wall of the nasal cavity. So you saw the nasal conchae and the nasal cavity as well. They help swirl and filter the air before it passes to the lungs. I guess this part was done in breathing and exchange of gases as well. Vomer, important. Median roughly triangular bone that forms the inferior portion of the nasal septum. So मीडियन है, सेंटर में है, जो एक ट्रायंगुलर बोन बनाता है ऊपर की तरफ इंफीरियर पार्ट में जाते हुए, इसीलिए नोज का शेप ऐसा कॉनिकल होता है, राइट? सो दैट इज गोइंग टू बी द नोज वाला पार्ट. मैंडिबल, median bone that forms the lower jaw, largest and strongest facial bone. Now see beta, largest कौन सा bone है, strongest कौन सा bone है, largest and strongest facial कौन सा bone है, your answers would change. So this is the largest and the strongest facial bone that they're talking about. ठीक है? Only movable bone of the skull. So you can see the entire skull is not in the capacity to मूव, ये बिल्कुल मूव नहीं करेगा, लेकिन ये देखो इसमें से कोई भी पार्ट मूव नहीं करेगा. कौन सा पार्ट मूव करता है? सिर्फ ये पार्ट. सो दिस इज द ओनली पार्ट व्हिच इज मूवेबल. Cranium is immovable, this is immovable, nothing can be moved except this portion. Only movable bone of the skull. It has curved horizontal body and two perpendicular branches which are called as rami. So you can see at the side, ये आपको दिख रहा है ये वाला part. This is called as the rami. They are perpendicular, right, to this part. Okay, they help in attachment to the muscles. ठीक है? It has lower row of the teeth lodged in it. Fine. And here you will be having a hyoid bone, जो यहाँ पर नहीं दिखाई देता है, because you know why it cannot be seen over here in my friend. See, it is U-shaped bone that does not articulate with any other bone present at the base of the buccal cavity. It is suspended from the temporal bone by ligaments and muscles. तो ये suspended form में होता है, इसलिए यहाँ पर वो दिखाई नहीं देता है in these type of skeleton. Okay, it is located between mandible and the larynx. So you know where is the mandible, you know where is the larynx. इनके बीच में ये ऐसा hang होता है, U-shaped bone. ठीक है? Got it now? Understood? Any difficulty in understanding all these? ये देखो. So they have shown the hyoid bone का proper structure which cannot be seen here. Therefore उधर पूरा detail में डाला है. Hyoid bone is U-shaped hanging bone. U-shaped hanging bone, beta. It's going to be present between the mandible and the larynx. It looks like this. ये ऐसे दिखता है. The one which you can see on your screen ना. It look like this. ऐसे दिखता है. Okay. And here also you can see very clearly how it look like. ये देखो. This is going to be your hyoid bone. ठीक है? Understood? I'm going to talk more on that. Don't worry. Yeah. So see, it has horizontal body and paired projections. ये देखो. 1 and 2 paired projections है उसके. Body कैसा है उसका? Horizontal body. Hyoid bone की बातें हो रही है. We're talking about the hyoid bone. It provides site for attachment of some tongue muscles and the muscles of the neck and pharynx. So you now understood the position perfectly, where it's going to be there. Huh? Yeah. If police suspect strangulation, they carefully inspect the hyoid bone and cartilage of larynx. They get fractured during strangulation. So if anyone has, tried to go for suicides, then अगर इधर अगर ऐसा सुसाइडल वो नॉट लेकर अगर इधर ऐसा ये लिया है डेथ अंडरगो किए हैं, सो द फर्स्ट थिंग टू हैपन इज दिस पर्टिकुलर हायोइड बोन विल गेट फ्रैक्चर्ड. तो ऐसे केसेस में है ना, तो कभी कभी क्या होता है, उनको कुछ अलग तरीके से मर्डर किया जाता है किसी बंदे को, और फिर उसको फैन से लटकाया जाता है. अब उसकी जान फैन से लटका के अगर गई है तो इट इज अ क्लियर केस ऑफ सुसाइड. But in that case, the hyoid bone will get completely fractured along with the cartilage of the larynx. Okay, so that is the first sign that the person has, been killed by someone else and सिर्फ लटकाया है उसको फैन पे, या फिर someone has actually gone for a suicide. ठीक है? Now, what is your doubt, beta? What is articulate? Articulate means to move. This is called as articulation. To move. Okay. Got it? Yeah. So these get fractured during strangulation. Various such investigations are done in case of suspicious death of an individual, where ossification of sutures in the skull, width of pelvic girdle are examined to find out approximate age of the victim or the gender of the victim. Okay. Strangulations means मराठी में उसको गलफास कहते हैं हम लोग. Okay. That is what गले को फांसी से लटक के डेथ ले जाना. Okay. Yeah. It will break only when it is going to get, like pulled. Hang to rope. Hang to death कहते हैं actually. That is what, with the help of a rope. Yes. Okay. So that is called as strangulation. So generally during strangulation this will happen. Hello. Fine. So this is the way, this hyoid bone is going to be of very great help, and it is going to be what? It is going to be hanging, na? It's going to be hanging. Fine. So this is the way it look like. Dekho beta, lesser horns and greater horns, and here you can see. I think so. You remember this thyroid cartilage, cricoid cartilage. We have seen the 4 types of cartilages in our breathing and exchange chapter. So here it's going to be sitting exactly over this thyroid cartilage. ये देखो, 2 lesser horns and 2 greater horns. समझा ये कैसे होता है? It's attached with the help of the ligaments to the tongue, pharynx and neck region. Any difficulty in understanding hyoid bone? It is one alone. It is one singular. It is not paired. वो एक ही होता है. So can you all count now how many bones are there of the face? Ligament. Yes, it's the ligament. Can you all tell me, beta? Hello. Then we have got what? See, ear ossicles. 3 tiny bones, namely malleus, incus and stapes, together called as ear ossicles, are present in the middle ear. We have done already about this in the chapter of neural system. Correct? Then the skull region articulates with the superior region of the vertebral column. Ab dekho, what is articulation? The skull. This is the skull. Correct? It articulates with the superior region of the vertebral column. Left, right, नीचे, ऊपर. इसको हम कहते हैं articulation. Correct? Got it? Right? Yeah. So this is the skull region which articulates with the superior region of the vertebral column and help the 2 occipital condyles for movement. उनके help से ही ये move करेगा. ठीक है? Got it? All of you? Any difficulty? Any doubt? Till now? Yeah, so just count. Come on, count करो इसको. 14 facial bones हमने यहाँ पर दिए हैं. 14 हो रहे हैं क्या देखो. Nasal. Start counting, हाँ. Maxillary. Palatine. Zygomatic. Lacrimal. Inferior concave. Mandible. Hyoid bone. 3 ear ossicles. हो गए 14.
670.
Correct. 14. All of you counted it.
650.
All of you all have understood this. Is there anyone who is having any difficulty in understanding? देखो बेटा इसके ऊपर short notes आते हैं एग्जाम में. I mean board exams की बातें करूँगी. Clear? आगे जाऊँ. Can I go ahead to the vertebral column now? Okay. Yes, my dear. So now we go ahead with the vertebral column. Human bone or skeletal vertebral column is made up of a chain of irregular bones called as vertebrae. So here also you can see these vertebrae very clearly, of course, from the back side. You can show you. Here. You can see this. This is the vertebral column, right up till here. Yahan tak. Okay, this is the vertebral column entirely. Right? So how is it? See, it consists of 33 vertebrae during the childhood. During the childhood, ये सबसे important वाली कहानी है. During the childhood. Okay. In adults, 5 sacral vertebrae fuse to form one sacrum. Please look at this. Can you all see this, beta? ये दिखाई दे रहा है आपको ये वाला part, right? So these are 5. You can count 1, 2, 3, 4, 5. There are 5 total in numbers, which fuse to form the sacrum. तो ये जो 5 है ये sacrum कहलाएगा, which is a broad triangular shape structure that you can see actually, right? That's the sacrum. And then they are saying the 4 coccygeal vertebrae fuse to form a single coccyx. Can you see this one, a small one? ये देखो ये दिख रहा है तुम्हें? Count it. 1, 2, 3, 4. So these are the 4 coccygeal vertebrae which fuse to form the coccyx. So this is going to be the coccyx. Coccyx is nothing but it is the base of our tail. So our ancestors had tails. So from where did the tail originate? ये coccyx में से. तो ये जो coccyx आपको दिख रहा है, so that is also called as the tailbone. Okay, it is also called as the tailbone. Well, so because of this fusion, now what will happen? 33 में से 5 एक group हो गया, right? So एक group है मतलब you have to consider that. So 33 minus 4 and 4 का एक group बन गया और एक group बना ना. So 33 minus 4 कितने हो जाएंगे? कितने हो जाएंगे बेटा? 33 minus 4, 29. Exactly. And 29 minus 4, but it will make one group. So 29 minus 3, how much? What's your answer? 26. Actually 24, 25, but 25 में एक group है ना, वो पूरा एक जो pockets दिखाई दिया आपको. So we cannot forget that one. So we have to add that one. So ultimately 3. So it becomes 26. So see, thus the total number of bones are going to be 26 of your vertebral column. But in the childhood, the sacrum is not yet fused. The coccygeal bones are not yet fused. So in childhood, it's going to be 33. Correct? Fine. But later on, as we become, we grow older, they become 26. So by the age of 5, it's going to be 26. So it extends from the base of the skull and constitutes the main framework of the trunk. Each vertebrae has a central hollow portion, which is going to be called as the neural canal, through which the spinal cord passes. So of course, you know that the vertebral column is protective in function. So it's going to be protecting the spinal cord. So right from the center, ऐसा हर एक वर्टिब्रे में एक सेंटर होता है, एक ओपनिंग होता है, और ये जो ओपनिंग है ना, ये ओपनिंग को हम क्यों क्या कहते हैं? न्यूरल कनाल. Okay, through which the thread-like spinal cord is going to pass. Have you all followed this? I'll tell you how do they fuse. Also, I'll show it to you. Okay. Now, what you have to remember that the shape. ये देखो, we have got 7 cervical vertebrae, 12 thoracic vertebrae, 6 lumbar vertebrae, 1 sacrum, and 1 coccyx. Now, beta, when we say cervical vertebrae or thoracic vertebrae, please don't misunderstand this. इसको बहुत अच्छी तरह से समझो. ये देखो, ये rib cage है. This is the rib cage, right? So this is going to be the thoracic cavity. यहाँ पर thorax है. तो ये thorax के बराबर पीछे के साइड के ये जो vertebrae है ना, इनको हम thoracic vertebrae कहते हैं. So which are the thoracic vertebrae? They are in the vertebral column only. But because इनके आगे का part thorax कहलाएगा, ये vertebrae को हम thoracic vertebrae कहते हैं. Okay, cervical vertebrae are the neck region. This neck region में you can see, right? ये जो neck region है, यहाँ के जो है, they will be called as your cervical. इसके नीचे 12 रहेंगे, which will be called as what? Thoracic. ये जो पार्ट है, ये पार्ट जहां अभी मेरा हाथ है, यहां तक thoracic है. You can see this ribs के आगे, ये rib के इधर अभी जिधर मैंने पकड़ा हुआ है, I have held. Let me hold him like this so that I can. So see, just above the sacrum you can see 1, 2, 3, 4, 5. Can you see 5? Right? So 1, 2, 3, 4, 5. These 5 are going to be your lumbar vertebrae. Then you have got this 1 sacrum and 1 coccyx. समझा बेटा? तो how many ribs are there? कितने ribs होते हैं हमारे में? Come on, tell me if you can recollect. How many ribs are there? In total. Number of ribs. Very good. 24. Correct? 12 pairs. Very good, Vedant. Very good, Peter. Yes. 12 pairs. So 12 ribs. ये जो 12 ribs है, वो देखो. Now look at this very carefully, yeah, बेटा. ये देखो. Now this rib, if I take the example of say this rib, ये वाला, ये ऐसे घूम के इसके अंदर से आके ये देखो किधर चिपक गया. Where has it articulated? Where has it got incorporated? ये ना. ये so ये देखो, ये जो ribs यहाँ से निकल आ रहे हैं साइड से. See from this we if we turn it, right? This is the sternum. यहाँ से भी मेरा finger पे ध्यान देना. It is moving, it is moving, it is moving, it is moving, and it is attaching to whom? The vertebral column. है ना? तो ये जो vertebrae है ना, जिधर 12 ribs connect होते हैं, those particular vertebral column का part which are attached with the ribs to each other, these will be called as 12 thoracic vertebrae. Did you all understand thoracic vertebrae मतलब क्या? The ones which are attached with the ribs. Okay? Clear? Thoracic vertebrae. उसके ऊपर neck region is cervical vertebrae. उसके नीचे जहां ribs खत्म हो जाते हैं, उसके नीचे वाला part is 5 lumbar vertebrae. Then we have got 5 sacrums fused together to form 1 sacrum. Sacral vertebrae fused to form 1 sacrum, and 4 coccygeal vertebrae fused to form 1 coccyx. All of you understood this? Any difficulty in understanding, beta? किसी को कोई भी point नहीं समझा तो please ask me. Understood? Very good. We talk about the curves now. called as your cervical curve secondary, thoracic curve primary, lumbar curve secondary, sacral curve primary. Now, what is this secondary, primary, primary, secondary? Let us try to understand that. But vertebral column, I hope तुम्हें समझ में आ गया है what I'm trying to tell you. See, there are 4 curvatures in human spine. Cervical and lumbar curves are secondary and convex, whereas thoracic and sacral curves are primary and concave. What do you mean by primary and secondary? So initially, when the vertebral column is being made, okay, they are almost going to be in the concave position. It's going to be almost in the concave position. As we mature, as the development takes place, now there's going to be, you know, एक कॉन्वेक्स, एक कॉन्केव, एक कॉन्वेक्स, एक कॉन्केव, ऐसा वाला एक शेप क्रिएट हो रहा है अपने vertebral column में. तो जो convex part है ना, वो concave is getting pushed towards one side to form a secondary curve. So your 2 curves are secondary and 2 curves are primary. Okay. Curvatures help in balancing in upright position, absorb shock while walking, and also protect vertebrae from fracture. There are 5 types of vertebrae in human spine: 7 cervical in the neck region, 12 thoracic in the chest region. Chest means, I told you, chest मतलब chest के बिल्कुल पीछे का side, right? Then 5 lumbar in the abdominal region, 5 sacral in the hip region, which are fused in adults forming one sacrum, 4 coccygeal, fused to form vestigial tailbone called as coccyx. So as I said, it's also will be called as coccyx. Understood? Keep it here. Then we talk about the typical vertebra. Okay? Typical vertebra मतलब हर एक vertebrae जो होते हैं वो थोड़े एक दूसरे से अलग है, but basic plan is the same. Basic plan is the same. You want me to show the curvature? ये देखो, ये कॉन्वेक्स हो चुका है, बाहर की तरफ आया, ये कॉन्केव है अंदर की तरफ, ये वापस कॉन्वेक्स बाहर की तरफ, ये अगेन कॉन्केव अंदर की तरफ. So you know it's going to be a typical curvature. Even in this, my friend also, you can see it very clearly, but it's okay. Got it? Yeah. Now we talk about the typical vertebrae. Typical vertebrae मतलब हर एक vertebrae का एक basic plan है. What do you mean by basic plan? Basic plan का मतलब क्या होता है कि when you enter a house, especially when you are in Mumbai, okay, anywhere but Mumbai because we all stay here, we know it better. So what is the basic plan of our houses? Living room, kitchen, bedroom, washroom, एक basic plan है, बराबर. अब किसी किसी का हॉल लेफ्ट साइड से होता है, किसी किसी का सीधा होता है, किसी का राइट में होता है, किसी का किचन एक अलग पोजीशन पे है, किसी का वॉशरूम एक अलग पोजीशन पे, बट बेसिक प्लान रिमेन्स द सेम. लाइक दैट टिपिकल वर्टेब्रे जो होते हैं ना, उनका बेसिक प्लान सेम होता है. ऑफ कोर्स दे डिफर फ्रॉम ईच अदर बाय सम माइनर चेंजेस. So what is the typical basic plan? Let us see. Each vertebra has a prominent central body called as centrum. So in the diagram, I want all of you all to focus on the diagram. It's very important. I'll move this. Yeah. So here you can see, this is the centrum. Here, prominent central body, which will be called as centrum. Centra of human vertebrae are flat in anterior posterior aspect. Anterior posterior matlab from back and front side, if you look at it, it looks flat in shape. So you can see over here, this is the centrum, which is almost, this is the posterior view, okay, which is almost flat. Look at the side view, beta. Ye dekho. Lateral view. So this is going to be the centrum. Okay, got it? Hence, human vertebrae are amphiplatian. Amphiplatian मतलब ऊपर से भी flat, नीचे से भी flat. Anterior posterior aspect से ये flat दिखता है. Then they are saying that from either side of the centrum are given out 2 short thick processes which unite to form an arc-like structure called as the neural arc. So here you can see very clearly this is the neural arc. ये देखो, है ना? You can see here, this is the pedicle, this is the lamina. They both fuse from left to right, they come up. है ना? ये एक arc बनाया, arc समझते हो ना? Correct? So they are making a, a very specific circular arc, which is called as neural arc. Fine. Now see, here also you can see, यहाँ पर जो है ये neural arc जो है यहाँ से ऐसे बनेगा. Okay, यहाँ से you can see this lamina. दिख रहा है आपको? Can see this here for lamina? Correct? Now see, neural arc forms the vertebral foramen. Foramen का मतलब क्या होता है? Cavity. So it's going to form the vertebral foramen which surrounds the spinal cord. So from here, you can see over here vertebral foramen. Correct? A cavity through which the spinal cord will pass. And it is going to be surrounding the spinal cord. Vertebral foramina of all vertebrae form a continuous neural canal. So ये neural canal किसका बना है बेटा? ये सारे vertebral foramen एक के ऊपर एक ऐसे रखेंगे ना हम लोग तो एक cavity बनेगी. That will be making your neural canal. Okay, got it? Spinal cord, along with the blood vessels and protective fatty covering, passes through the neural canal. Tell her I'm in lecture. Call up at 6. Spinal cord along with blood vessels and protective fatty covering passes through the neural canal. So everything is going to pass through the neural canal. Very clearly you can see the cavity over here. Okay, so ये ऐसे है ना, ये ऐसे एक के ऊपर एक ऐसे करके ये न्यूरल कैनाल बनेगा जिसके अंदर से ये स्पाइनल कॉर्ड भी जाएगा and the spinal cord along with blood vessels and also it's going to have a fatty covering to pass through it. So can you imagine this? How is the basic structure of each vertebrae?
Here also I showed you.
See, I know it's very difficult to actually see this over here, but still, I think from this end you can see. ये देखो, you can see this. ये rings दिखाई दे रहे हैं तुम्हें एक के ऊपर एक. How they are kept one above the other? Yeah, very clearly you can see these rings, right? So these are going to be your, this is going to be your basically making up the neural canal जिसके अंदर से ये जाएगा, spinal cord जाएगा और पीछे से ये processes भी दिखाई देंगे आपको. Can you see the processes? These type of processes which are going to be formed. दिख रहा है तुम्हें? So ये जो side में आ रहे हैं ना ये दो, these are the transverse processes. And here you can see along with the transverse process, can you see this? Which is protruding outside. This is the spinous process. Here, spinous process. Sideways जा रहे वो है lateral. बाहर की तरफ protrude कर रहे तुम्हारे तरफ वो है spinous process. Exactly. Got it? समझा? Yes. So this is how it's going to be exactly looking like. But each and every vertebrae, as I said, have got their own specific specialities. Now in your first year MBBS, what do they do is they give you separate vertebrae and they ask you to form this vertebral column. Now you have to fit them perfectly. Perfect अगर fitting नहीं हुआ तो तुम्हें वो secondary and primary curvatures दिखाई नहीं देंगे. You will lose your marks. So there is a trick to that also. I'll share the trick. Don't worry. Yeah, but someone had asked me that how do they fit into each other. So please look over here. Here you can see very clearly superior articular process. You can see here. inferior articular process. You can see here. So the one which is upper, जो ऊपर वाला vertebrae है और जो नीचे वाले vertebrae है, they will fit like this way into each other. Okay, ये ऐसे fit होते हैं. So superior of first will articulate with the superior of first, ये superior है, will articulate with the inferior of the other. ये देखो, okay, फिर ये ऐसा, फिर ये ऐसा, तो ये ऐसा ना क्रिस क्रॉस पैटर्न में वो फिट हो जाते हैं. So superior of first will be associated with the inferior of the next. ऐसे करके वो एक दूसरे में जिक्सॉ पजल के जैसे फिट हो जाते हैं. Fine, and they should not undergo friction. Okay, so to avoid friction, they are going to have something called as vertebral disc. Vertebral disc होते हैं. You might have heard about this term called as वो बंदे को slip disc हो गया. Heard about it? Yes, exactly. Yes, you might have heard about this word slip disc. So what exactly is that slip disc? So दो vertebrae के बीच में there is going to be this, a cushion-like thing, which will help them to move. तो कभी कभी क्या होता है, because of pressure, because of overweight, because of heavy exercise throughout life, these discs na, they just become very thinned out, or sometimes they just fall off, they just slip away, and then the two vertebrae will come directly in contact with each other and there will be friction which will be very painful. So that is called a slip disc. Okay, well, let us go to individuals. Okay, yeah, regularly, बहुत often, बहुत ज़्यादा अगर ये किया तो yes. Point where two processes of centrum meet, neural arc is drawn into spinous process, which is called as neural spine. From the base of the neural arc, two articulating processes called as zygapophyses are given out on either side. The anteriors are called superior and posterior are called as inferior zygapophyses. In a stack of vertebrae, inferior zygapophyses of one vertebrae articulates with the superior zygapophyses of the other vertebrae. So just now as I said, एक का inferior दूसरे का superior fit हो जाते हैं, locking process, just like a lock. This allows slight movement of the vertebrae without allowing them to slip off. At the junction of zygapophyses, a small opening is formed on either side of the vertebrae, which is called as intervertebral foramen, that allows passage of the spinal nerve. So in the neural chapter, we have seen spinal nerves, right? 31 spinal nerves. So they need to reach the spinal cord to the body parts to bring or take the impulses from the spinal cord towards the effector organ. So that is done via these small openings which are going to be present in between. Okay. From the base of the neural arc, lateral processes are given out, which are called as transverse processes, which we saw just now. Neural arc, neural spine, transverse processes are meant for attachment to the muscles. So in this way, your vertebral column is going to be having the capacity to have a little bit of movement. So you can bend down, you can lift your body up, you can actually, when you look towards your left, when you look towards your right, you're putting a pressure on your back, your vertebral column is getting a bit twisted. Okay, you will not recognize or realize that unless and until it pains. So the minute it starts paining, you realize that, oh my God, एक side देखना है तो मुझे ये vertebral column पे pressure आ रहा है. Only that time you will be able to realize it. Okay. Zygapophyses are these, beta. ये देखो. Superior articulating processes जो लिखे हैं ना, these are the zygapophyses. इसको हम zygapophyses कहते हैं, the black ones. Superior and inferior zygapophyses. Now got it? Locking. Actually, zygapophyses are going to be, like locking agents, just like locks. ठीक है? Any difficulty in understanding any point, beta? Just go through it. देखो एक बार बताओ मुझे कुछ difficulty है तो. Clear? Can I move ahead with the content? All of you? As I say, a little bit of modification seen in each vertebrae. Let us see. Modification seen in vertebrae. The first is going to be called as atlas vertebrae. This is a ring-like first cervical vertebrae. Neck region का first है ये. It consists of anterior and posterior arcs. So anterior arc भी है, posterior arc भी है. बेटा ये सारी चीजें आपके NCERT बुक में नहीं दी है, लेकिन ये important है. Okay, so please don't neglect this. Here you can see the anterior arc very clearly. दिख रहा है आपको anterior arc, हाँ? And here you can see the posterior arc. Okay. It does not have centrum and spinous process. So ये first vertebra जो अपना है, यही थोड़ा सा हटके है, जिसमें centrum ही नहीं है. Okay, so the vertebra does not have a centrum. Now, what is the reason for it to not have a centrum? Also, we will come to know. So, main उसका जो body होता है ना vertebrae का, वही नहीं है, centrum ही नहीं है. Okay, it does not have a centrum and it does not have any spinous process. Transverse processes and transverse foramina are large. So you can see large transverse processes. And even the foramens are very huge. बड़ी बड़ी cavity दिखाई दे रही है आपको, है ना? Vertebral column, vertebral foramen is large and divided into two parts by transverse ligament. So actually speaking, अगर देखोगे ना बेटा, तो ये देखो, ये ना इधर से ऐसा transverse ligament होती है, which will divide this particular area into two parts, anterior portion and posterior portion. So इन दोनों के बीच में यहाँ से ऐसा एक ligament, transverse ligaments होते हैं. ठीक है? Spinal cord passes through the anterior compartment. So this is the area from where the spinal cord is going to be passing. Anterior compartment में से spinal cord pass करेगा. Anterior zygapophyses are replaced by facets for attachment to the occipital condyle to form the yes joint. So whenever you say yes, whenever you move your head as yes joint, how are you, like, how do you have the capacity to move your head in that yes wala position? So here you can see these are the facets for articulating with the occipital condyle. So in neural chapter we had seen that there are two occipital condyles in humans, इसलिए हमें dicondylic कहा जाता था हमारे skull को. So ये जो दो condyles हैं अपने skull के, they have to be perfectly placed in between two facets. Facets क्या होते हैं? What are facets? Like a bowl or a saucer type of a thing, in which this particular condyles will fit perfectly, so that you can have a yes joint. Okay, so ये इसके लिए आप पहले सिर ऊपर लेते हो, फिर नीचे लेते हो. So it should be perfectly moving in a particular fashion, because these condyles are going to be placed perfectly in these two sockets. Did you all understand how it is? So they do not have zygapophyses. They do not have zygapophyses. Instead, they are going to have the articulating facets present over there, in which the two condyles will be perfectly placed to form the yes joint. So बेटा ये याद रखना है आपको कि atlas जो होता है, it is the first vertebrae of the vertebral column. It is going to be present in the cervical region, that is the neck region. It is not going to have a centrum. It's not going to have any zygapophyses. Rather, it's going to have facets for holding the two condyles of the cranium in place. Okay. The cavity, the foramen, is very large, which will be divided into two compartments with the ligament, that is anterior and posterior. From the anterior region, the spinal cord is going to be passing through it. And why it has to be large, my dears? Because spinal cord है ना, जैसे नीचे neck से नीचे आता है तो वो ऐसे conical shape में होके पतला 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 बन जाता है. तो medulla oblongata का ही extension है वो. So it's going to be a bit thicker in size. So to fit that, this particular the first vertebra should be a bit having a larger foramen, larger cavity. Did you all understand this? Atlas में कोई difficulty है बेटा? Atlas vertebrae centrum absent है, please याद रखिएगा ये point. Second comes the axis vertebrae. Now let us understand that what is this speciality of the axis vertebrae. So axis vertebrae is the second vertebrae of the cervical vertebra. Centrum of this vertebrae gives out tooth-like process called as odontoid process. Odontoid is associated with tooth. So you can see this tooth-like process. ये देखो, तो इसका centrum flat नहीं है, इसका centrum कैसा है? The centrum of axis is going to be tooth-like, just like your tooth. And from where? See, how is it coming out? Can you see? It is coming from the posterior part of the atlas. देखा? तो ये देखो, ये posterior part of the atlas है, इधर से ये ऊपर आ गया, odontoid process. Anterior portion में से spinal cord नीचे गया और posterior portion में से ये odontoid process ऊपर आया. Understood what has happened? So ये odontoid process के यहाँ पर you can see, यहाँ से if you look at this place ना, there will be the atlas vertebrae. So see facet for atlas. यहाँ पर atlas vertebrae बैठेगा, एक के ऊपर एक बैठ रही है. So ये atlas है, ये axis है, तो ये atlas को axis पे perfectly fit कराने के लिए there is going to be two facets. So the process fits perfectly into the anterior portion of the vertebral foramen of atlas vertebrae, forming a pivot joint, which is also called as a no joint. Okay. So yes joint is atlas and no joint is axis. Please remember this. And remember that axis is going to have an odontoid process. Don't forget this. Odontoid process is a tooth-like process. That's it. Any difficulty in understanding these? कोई प्रॉब्लम है बेटा ये समझने में? एटलस एंड एक्सिस दोनों अलग है, बाकी ग्रुप में है. सर्वाइकल सारे के सारे 12 के 12 सेम दिखते हैं, लंबार 5 के 5 सेम दिखते हैं, सैक्रम तो एक ही है, कॉक्सिस भी एक ही है. So these two are cervical के 7 में से these two are a bit different. So have you all understood it? Anyone who has not understood any point of atlas and axis? Yes joint, no joint. Please remember this. If you are saying yes, you have understood yes, that means your atlas is moving. If you are saying no, I haven't understood, your axis is moving. Okay, so I hope everyone's atlas is moving. Axis है तो बोलो, कोई problem नहीं, I can explain it again. Okay. Then we come to the cervical vertebrae. Vertebrae number 3 to 6 are called as typical cervical vertebrae. They show short centrum and bifid spinous process. Bifid means ऐसे दो parts में ऐसे उसके processes divided दिखते हैं. Bifid spinous process. Transverse process of these vertebrae are reduced, each having large vertebral arterial canal at its base for passage of the vertebral artery. So arteries, veins, everything has to pass through it. The 7th cervical vertebrae, which is called as vertebra prominence, it is the largest cervical vertebrae where neural spine becomes straight. So 7th जो cervical vertebra है अपना neck region का, वो एक ही है जहाँ पर अपना neural spine जो है ना straight होता है. Otherwise it's in the curved position, either convex or concave. Okay. Now these used to be the questions that they used to ask for your AIMS examination and all. But anyways, now we have got only NEET. Thoracic vertebrae. Now all 12 thoracic vertebrae appears to be same. These are 12 in number, found in the chest region. Again, as I said, chest region means आगे नहीं बेटा, पीछे हाँ. Exactly पीछे. Centrum of thoracic vertebrae is heart shape. Look at the shape of the centrum. So This is the shortcut that you can arrange the entire vertebral column if they give you spare parts of vertebrae. So you can easily find out the atlas and the axis. है ना? Atlas में centrum ही नहीं है. So it becomes easy to find out that. Axis में odontoid process है, which is easy to find out. Then you have got 7 cervical typical vertebrae with bifid processes. No other is going to have bifid processes. So only these are going to be having bifid processes. So you can bring up next 7 in line to make up your next 5 in line to make up your 7 cervical vertebrae. Then you can go for looking at the heart-shaped centrum. Wherever you see heart-shaped centrum, thoracic vertebrae. Okay. So centrum of thoracic vertebrae is heart-shaped and all processes are very well developed. Except for vertebral number 11 and 12, transverse processes of other thoracic vertebrae show facets for attachment with the ribs. We know because 11th and 12th are going to be your floating ribs. So they don't have facets. Okay, they don't have facets to articulate with the vertebral column. Lumbar vertebrae का speciality देखो कैसा है. They are of course 5 in number. And they are well-developed vertebrae that exhibit the characters of a typical vertebrae. And the centrum is going to be kidney shape. So just looking at the shape of the centrum, ना तुम्हें तुरंत पता चलना चाहिए कि ये thoracic वाला है, ये lumbar वाला है. हाँ, देखो इसका shape देखो, बिल्कुल clear है. It's just like a kidney. See, the centrum is just like a kidney, right? Correct. You can see the vertebral foramen through which the vertebral column is going to be passing. Vertebral foramen, vertebral column will be, I mean, your spinal cord will be passing. So look at the shape. Look at the shape and do the smart work for your MBBS first year. First year MBBS का जो तुम्हारा practicals होगा ना, उसकी तैयारी तुम लोग अभी से कर रहे हो. देखो क्या बात है. Okay, so this is thoracic and lumbar. I hope you all have understood. Sacrum is triangular bone formed by the fusion of 5 sacral vertebrae. It is located in the pelvic cavity below the 2 hip bones. Anterior end of sacrum is broad and posterior end is narrow. You have seen just now. Vertebral foramina that are formed by fusion of vertebrae are also seen. So I showed you those 5 holes on the left and right side. Those are your fused vertebrae. Reduced neural spines can be observed projecting from dorsal aspect of the sacrum. So you can also see very small neural spines जो just emerge होते हुए दिख रहे हैं. It gives strength to the pelvic girdle. So I told you the pelvic girdle is going to be the one which is going to be towards the lower part of our body, and your upper part जो है that is going to be your pectoral girdle. Girdles आएंगे अपने appendicular में. Coccyx is formed by fusion of 4 coccygeal vertebrae. It is reduced and does not show vertebral foramina, no spinous processes. Transverse processes of coccygeal vertebrae are also highly reduced. It's a triangular bone, which I've already shown you. So you can see over here in this diagram, sacrum and coccyx. So see, these are the 1, 2, 3, 4, which are going to be the foramens for passaging of the nerves. So spinal nerve जो है यहाँ से निकल आते हैं, right? Surface for articulation with the left ilium, that is going to be your how the girdle is going to be formed. All of you have understood the vertebral column in detail. Anyone who has not understood any point, beta? All okay? Great. This is already done in our breathing and exchange. Anyways, because it's a part of your skeleton, we are repeating it. It consists of 12 thoracic vertebrae, 12 pairs of ribs and breastbone. That's the sternum. Sternum is flat, narrow bone around 15 centimeters in length. I showed you just now. It is placed medially in the anterior thoracic wall, that is the chest region. It consists of 3 parts: manubrium, body, and xiphoid process. So here you can very well see in the diagram also you can see, here also you can see, it's perfectly seen. So you can see this portion where my finger is right now. ये देखो ये यहाँ से पूरा. This is going to be the manubrium. This is going to be the manubrium. Can you see? Yeah. ये वाला part. Manubrium. Then this is going to be your entire one is going to be the body, and this is going to be the lower end will be called as the xiphoid process. Okay, that is the xiphoid process. So in this way, here also in the diagram also you can see it very clearly. The manubrium, this is the body, and this is the end portion which is called as the xiphoid process. Okay, manubrium shows two notches on anterior lateral side for attachment with clavicle of each side. So here you can see this particular one again. इसको मैं ना मेरे गोदी में ही बिठा के रखना चाहिए ऐसे. So you can see this. ये जो आपको दिखाई दे रहा है बेटा ये वाला, right? This bone, where is it fitted? See, it is fitted in the manubrium. Correct? It's perfectly fitted into the manubrium. So manubrium shows two notches on anterior lateral side for the attachment of clavicle. So ये जो bone है ना, ये shoulder bone, ये देखो ये वाला, इसको हम कहेंगे clavicle. It also shows two notches on each side of the lateral side for the arrangement of the two pairs of ribs. So यहाँ पर ऊपर की तरफ से, यहाँ से ऊपर की तरफ से ये जो है ये अपना clavicle attached है, और इसी को नीचे की तरफ से, can you see where my finger is placed now? I'm moving my finger. This is also the xiphoid process only, but at this end it's going to be the rib which is attached. So it has got two notches, one for the attachment of the clavicle, one for the attachment of the ribs. Clear? Understood? So in this diagram now, you cannot see the attachment of the clavicle. इधर से ये नीचे वाला rib है और ये ऊपर का जो एक cavity है, that is going to be for the clavicle. This is for the rib, this is for the clavicle. Of course, in my friend, you can see it very clearly. Right? Wait. So, body of the sternum is flat bone. You can see very clearly. Okay, that shows 5 notches on lateral aspect which are meant for direct or indirect attachment of the ribs. You can very well see 1, 2, 3, 4, 5. यहाँ तक बॉडी है बेटा, इसके बाद में ये xiphoid process स्टार्ट होता है. Okay, correct. Ribs are attached to the sternum by means of cartilaginous extensions called as the costal cartilages. Xiphoid process is lowermost part of the sternum, which is cartilaginous initially and gets ossified in adults. So cartilage will eventually become bone. It provides space for attachment of diaphragm and abdominal muscles. So xiphoid process से attachment होता है अपने यहाँ पर attachment of the diaphragm and the abdominal muscles internally. Clear? No problem in understanding these points. Ribs. A rib is a she-shaped bone that is attached to respective thoracic vertebrae on the dorsal side. 12 pairs of ribs are attached to 12 thoracic vertebrae. For this attachment, posterior ends of the ribs have two protuberances, namely head and tubercle. So here, of course, इसमें थोड़ा दिखना मुश्किल है आपको. अगर ये इसलिए बोली कि मैं फिजिकल लेक्चर में ये लेके आऊंगी ये बंदे को. So maybe internally आप देखोगे तो you will be able to see. See, internally if you look at the ribs, I don't know if you'll be able to see or not. Really not sure about it. Can you see here? These points. ये points देखो बेटा जहाँ मेरा अभी finger है. You can see these points, or you can see this point. So these are going to be your two processes, that is tubercle and neck. Right? So ये इधर भी है tubercle and neck, of course, but still. So the head of the rib attaches to the facet formed by demifacets of adjacent thoracic vertebrae at the base of transverse process. So how are they going to be attached? Demifacets means further division of the facets. Okay, so the head of the rib attaches. Head of the rib, ये जो है पीछे से आगे आता है. So ये जो पीछे वाला head of the rib है, it will be attached to the facet. Facet means, as I said, a cavity-like thing, not a hole, like a saucer-shaped structure or a cup-shaped structure or something like that. Okay, and it is formed by whom? By the adjacent thoracic vertebrae. तो इस तरीके से ये एक दूसरे के साथ भी है ना attached होते हैं, so that they don't slip off at the base of transverse process. Tip of transverse processes of these vertebrae also have facets for attachment of the ribs, where tubercles of the ribs are attached. तो ultimately क्या है, ये जो पूरा अपना rib cage है, as we call it, this entire rib cage, it's C-shaped. See, it's like this, right? So this entire rib cage जो है, ये इस तरीके से form होता है by overlapping and attaching each other perfectly. ठीक है? Got it? Well, on the ventral side, the ribs may be or may or may not get attached to the sternum directly. So ये देखो, यहाँ पर आप देख सकते हो, यहाँ पर 1, 2 and 3 are attached to this one. You can very well see here, right? You can see all of them clubbing together. You can see all of them clubbing together. See, right? Yeah. So depending on their attachments, ribs are classified into 3 types: true, false, and floating. This you know already. First 7 pairs of ribs are attached directly to the sternum by means of their coastal cartilages. False ribs, coastal cartilages of rib number 8, 9, and 10 are attached to rib number 7. You can see here actually. ये 7th है, 8, 9, 10th, all are attached to rib number 7. ये देखो, इसके साथ ही attached है, like branches. Yes, yes. Okay. Hence, these are called as false ribs. Floating ribs, last 2 pairs of ribs have no ventral connection. Hence, they are called as floating ribs. I'm sure you can see the floating ribs over here. ये देखो. You can see this halfway. ये halfway है. ये देखो. 1 and 2. These are halfway left. These 2 are going to be called as what? Floating ribs. Right? They are going to be called as floating ribs. Space between the ribs is called as intercoastal space. Ribs provide space for attachment of the intercostal muscles. So we have already seen that how the IICM and EICM are going to be held. So मेरा हाथ अभी अंदर से मैंने डाला है बेटा, आपको दिखाई दे रहा है ना? So something like this where the intercostal muscles are going to be placed. We have seen them, EICM and IICM. Approximately 8% of the humans have an extra pair of ribs attached to the lumbar vertebrae. What is the use of? They are required to maintain our body posture. Okay. 8% of humans have an extra pair of ribs attached to the lumbar vertebrae. Okay. Apart from your floating ribs, extra pair hoti hai. Such a rib is found in some types of gorillas. Hence, 13th pair of rib is called as gorilla rib. So some, only few, very rare humans have got this 13th pair of ribs. And they aren't gorillas, but the gorillas are going to have the 13th rib. And so these people are said to have gorilla ribs. Okay. Thoracic vertebrae, ribs and sternum together forms the rib cage. So this is already known to you all. Correct? Okay. Well, so अभी ये axial skeleton का अपना काम हो चुका है. Now we go to the appendicular skeleton. ठीक है? So sideways. Okay? Sideways. Appendicular skeleton consists of bones of limbs and girdles. So ये जो pectoral girdle है और ये जो pelvic girdle है, right? These will come under appendicular skeleton. ये मुझे यार छोड़ेगा ही नहीं शायद, मेरे को लेके जा रहा है. Okay, so pectoral girdle, also called as the shoulder girdle, it attaches forelimb skeleton with the axial skeleton. Okay, so now I need the leg. I want hand. This is also a leg. This is what I have. You can see now. डरो मत, कुछ जादू भी तो नहीं कर रही हूँ मैं. ओके, एक साइड बस बेटा. ओके, ये है. Then you can see this and finally this. ठीक है ना? You can see it very well. Yeah. So this is going to get attached in this particular cavity. You can see now my friend is trying to dance. See, don't make that noise. Leave it. Don't make that noise. See, he is about to dance now. Can you see? Right? Yeah. So shoulder girdle attaches forelimb skeleton with the axial skeleton. Okay. There are two pectoral girdles, each of two, matlab one on the right side, one on the left side. Okay, two pectoral girdles, each consisting of shoulder blade or scapula and collarbone or clavicle. So here you can see this clavicle. यहाँ पर जो है ये clavicle है और इसको scapula देखो बेटा. ये जो दिखाई दे रहा है ना, this is the scapula. So ये scapula है, ये clavicle. Scapula, clavicle. Right? Understanding? So clavicle, it is S-shaped slender bone. You can see this S-shaped slender bone. Right? Correct? One end of the clavicle is attached to the acromyon process of the scapula. One end is attached with the acromyon process of the scapula. तो ये जो है acromyon process से ये attached है यहाँ पर. Okay, very clear. You can see the attachment of the scapula with the clavicle. है ना? तो ये जो point of attachment है इन दोनों का, that is going to be called as acromyon process of scapula. Okay. The other rounded end, called as the sternal end, is attached to the manubrium of the sternum. So here you can see ये जो process है, which is attached to the manubrium of the sternum, ये point. Okay, what is this point going to be called as? Rounded end called as the sternal end. Sternal because it is attached with the sternum. So यहाँ से clavicle sternum से attached है. Sternal process, acromyon process attached with the scapula. Please remember these things. Don't forget these. Okay. Then this connects upper arm skeleton to the axial skeleton. So very clearly seen in the diagram, you can see it also. This is going to be the, I'll talk about the limbs, of course, that is humerus, ulna, kidhar hai, sab kuch bataungi. Filhal focus on this clavicle. This is the acromyon process, which can be seen very clearly in this particular one also. Ye jo aisa yahan par aa raha hai wo acromyon process. Then you have got this, which is going to be the Karkhanis process. Karkhanis process, filhal koi aap tension nahi lena. Then you can see this is the glenoid cavity where these two are actually going to get attached. So इन दोनों का जो attachment होता है, तो इन दोनों के बीच में होता है glenoid cavity. What is it? I'll tell you later. Any difficulty in understanding till here? Anyone has any problem till here? Clear? Scapula is a large, flat, triangular bone that occupies posterior chest wall extending from the 2nd to the 7th rib. So you can see over here, this is the triangular bone, which is occupying second से seventh rib. ये देखो, second rib से start होता है, seventh rib तक आ जाता है. It is attached to the axial skeleton by muscles and tendons. It has a lateral angle. At its lateral angle, scapula bears a concave socket called as the glenoid cavity. तो यहाँ पर एक आपको socket दिखाई दे रहा है, बिल्कुल clear. So this socket will be called as what? जिधर मेरा अभी finger जा रहा है, right? You can see my fingers entering. This cavity will be called as glenoid cavity. Head of the uterus. This is head of the uterus. ये देखो, this is the head, right? It will articulate. Right? So the head of the uterus fits into this glenoid cavity. Right? Two processes arise from the scapula, a beak-like paracoid process that projects from the lateral angle to the scapula, and Lacrimal process, easily felt as your high point of shoulder. तो अगर आप shoulder को touch करोगे ना, touch your own shoulder, you will feel a projected end. देखो ऐसे हाईएस्ट हाई पॉइंट दिखाई देता है आपके शोल्डर पे हर एक के. That is going to be the Lacrimal process. Both are meant for attachment of the muscles. Yeah, yes, it defines the length of our shoulder. तो जब हम शर्ट पहनते हैं या इवन ड्रेसेस, तो स्लीव्स जहां पर अपना एंड होता है ना स्लीवलेस में, that is going to be the point actually, the high point. Okay, understood this very well? Any difficulty? Good. Bones of the forelimb. फिलहाल के लिए भाई साहब को थोड़ा बाजू में रख रही हूँ, बहुत परेशान करता है, मेरे ऊपर गिरता रहता है ये. Yes. So I come to the bones. It consists of humerus. So this is the humerus, you can see very clearly, and the ulna, which is this portion. So radius, ulna, humerus, ये तीनों मिलाकर अपना forelimb बनता है. Bones of the wrists are carpals. So ये wrist है बेटा, ये जो part है ये वाला, ये wrist का part है, right? So these are going to be the carpals. Bones of the palm are metacarpals. So यहाँ तक, ये देखो, यहाँ तक आपका metacarpal है, right? This is going to be the metacarpal. And digits of the phalanges. So these are your finger के. So 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2. Look at your own thumb. You have got only two things. ये 1, 2, 3, 1, 2, 3, right? So this is going to be the, you know, अपने hand के बारे में बातें हो रही है. So in total we have got 30 bones. Can you all count बेटा? एक हाथ का काउंट करो, एक ह्यूमरस, एक रेडियस, एक अल्ना, 3 हो गए. हाँ, रिस्ट में कितने होते हैं ये आपको नहीं पता, ये आगे मैं बताऊंगी. बट पाम में कितने होते हैं पता है, फिंगर में कितने होते हैं पता है. तो 30 को उसमें से माइनस कर लेना. व्हाट शुड बी योर answer in the wrist bone? Of course, when you take this in your hand, you can count them. 1, 2, 3, 4, 5, 6, 7, 8. So there are going to be 8 in the wrist. ये भी हम लोग detailing करेंगे, don't worry, of course. So, yeah. Huh. So humerus, this is the bone of the upper arm. It has a hemispherical head at its proximal end. You can see this very well. Hemispherical head at its proximal end. Can you all see this or no? Yes. Okay. So ये जो है ये hemispherical head है on its proximal end. On the either side, of the head of the humerus are present a pair of projections called as lesser and greater tubercles. So you can see over here, ये बीच में आपको एक मीडियन लाइन दिखाई दे रही है और ये साइड पे और ये साइड पे आपको ट्यूबरकल्स दिखाई देते हैं. ओके. There is a deep groove between the two tubercles, which is called as bicipital groove, where a tendon of bicep muscles is attached. Okay. Shaft of the humerus shows deltoid tuberosity. तो ये shaft मतलब ये entire length अंदर से. Okay. Is going to show a deltoid tuberosity. Deltoid tuberosity means where the bone marrows are going to be present. You know what is a bone marrow? Distal end of the humerus shows pulley-like part called as trochlea that articulates with the ulna. So here you can see ये वाला, हाँ बेटा ये वाला, ये जो अपना है ना, इसी का ये part है. You can see this. देखो, which will perfectly fit into the ये फिट होता है बराबर एक दूसरे में. Okay. So that is going to be articulating with the ulna. That is called as your trochlear part. ठीक है. Radius and ulna. Radius is located laterally on the thumb side of the foramen. So जहां thumb है ना आपका, ये thumb है आपका बराबर. तो ये साइड का जो आपका बोन है, आप देखिए. Look for yourself. The way I'm holding my hand, just try to hold it. You can easily feel इधर यहाँ ये साइड पे अपोजिट साइड पे आपको इजीली दो बोन्स दिखाई देंगे बेटा. यू कैन फील द टू बोन्स, राइट. सो द वन व्हिच इज टुवर्ड्स द थंब रीजन, दिस साइड वाला जो थंब रीजन वाला है, दैट इज गोइंग टू बी द अल्ना. एंड लिटिल फिंगर के साइड वाला जो है, दैट इज गोइंग टू बी द रेडियस. उल्टा बोला, रेडियस जो है वो थंब रीजन का है और अल्ना जो है वो लिटिल फिंगर का है. Okay, so proximal end of the radius has disc-like head that articulates with the humerus bone. So just now we saw that. The shaft of the radius widens distally to form a styloid process. Ulna is located medially on the little finger, okay, of the foramen. तो ये little finger के पास से जो जा रहा है वो अपना ulna है. Thumb के पास से जो जा रहा है वो अपना radius है. So here also you can see this. ये देखो. साइज में भी डिफरेंस समझ में आ रहा है. दिस इज थिकर, दिस इज थिनर, राइट. दिस विल बी लाइक दिस. सो द थिकर वन विल मूव टुवर्ड्स द थंब एंड ये जो है इट विल मूव टुवर्ड्स द लिटिल फिंगर. ठीक है. At the proximal end of the ulna, there is a prominent process called as Olecranon process that forms the elbow joint with the humerus. तो ये देखो बेटा, ये जो elbow joint है ना, एक ही पोजीशन में जाता है, उल्टा नहीं आता है, एक ही पोजीशन में जाएगा. This is going to be called as Olecranon process. ठीक है. यहाँ पर you can see this Olecranon. It's the Olecranon process. On the lateral side, then near the upper end of ulna is present a radial notch in which the head of the radius is fixed. So of course they have to be fixed perfectly within each other. Radius and ulna articulate with each other at the upper and the lower extremities by superior and inferior radio-ulnar joints. That's okay. In between the shaft of the two bones, this is important, interosseous membrane is present. So here you can see a cavity. In between radius and ulna, you can see a cavity, right? Where my finger is moving. This cavity is going to be filled with interosseous membrane. So ये cavity नहीं होती है. ये cavity is filled up with something called as interosseous membrane. Remember this. See, when you touch, can you feel the cavity? आपको ये cavity feel हो रही है? Soft कुछ लग रहा है कि नहीं दोनों के बीच में? ये है. उनके बीच में आप try to poke your fingers over here. You will actually feel a soft thing present between them. That is going to be filled with interosseous membrane. ठीक है? हाँ. That is what? That soft thing is nothing but the interosseous membrane है बेटा. वो bone नहीं है, कुछ नहीं है. Okay. Carpals. These are the bones of the wrist, as I said just now. arranged in 2 rows of 4 each. So we have got 8 in total. 8 wrist bones होते हैं अपने. Metacarpals, 5 elongated metacarpals form the palm bones. The proximal end joins the carpals and the distal ends to form the knuckles. I don't know, आपके ज़माने में कभी आपके टीचर ने knuckle पे आपको मारा है क्या? Have any one of you had knuckle पे with scale? Yes, with scale, wooden scale. हमारे टाइम पे तो wooden scale हुआ करती थी, है ना? That's the only way to, you know, make you all act like students. नहीं तो तुम्हारा तो लाइफ दुनिया सब अलग ही है. ये नकल्स पे जो मारते हैं ना इधर, these are the knuckles. तो नकल्स पे जिसने मार खाया है ना, हाँ, हाथ सूज जाता था, of course. Those are real students, I would say. आप में से किसी ने, सिर्फ only one student is saying कि हमारी ट्यूशन टीचर मारते थे करके? None of you? हाँ? अरे बाप रे, फिर तो I should show you what are knuckles. हाँ? मुझे ही फिजिकल लेक्चर्स में आके तुम्हें नकल्स क्या है दिखाना पड़ेगा, और वो सोचते कैसे वो भी दिखाना पड़ेगा क्या? नो ना, नहीं बाबा, आई डोंट यूज ऑल दीस टैक्टिक्स प्लीज, आई एम सॉरी. बट एनीवेज, इन स्कूल डेज इट वाज देयर, एंड ड्यूरिंग आवर डेज इट वाज डेफिनेटली देयर. तो होमवर्क नहीं किया मतलब आज खत्म. आज नकल्स पे पढ़ने वाली है, हमें पता ही हुआ करता था. It was very painful. Painful से भी ज़्यादा, it was very insulting in front of all my friends. If I'm going to get, you know, this type of treatment, oh my God, मैं शर्म के मारे मर जाऊंगी. So I was like very scared of this. कि मारना, लगना, swelling होना, ये सब secondary बातें थी मेरे लिए. I used to feel very insulting. You know, it used to come on my ego. I was so small, but still, like I used to always feel no, not in front of my friends, not in front of other students. I should not get bogged down because of my, you know, not doing my homework, not learning, not studying, not getting marks. I used to only do all these things, you know, कि नहीं, मुझे insult नहीं करना है मेरा खुद का. So at least उसके लिए तो. Of course, eventually it became a habit of, you know, doing the things genuinely, but initially. Anyways, so you know what are knuckles now. Phalanges, yeah, I know. Phalanges, these are the bones of the fingers and the thumb. So 1, 2, 3, one bone, second bone, and the third bone, right? 4 fingers have 3 phalanges each, and the thumb has 2, thus making it 40 phalanges in one hand. So if you count in totality, we have got 30 bones in one arm. Correct? Clear? All of you? Well, then we come to the pelvic girdle, very well shown in the diagram. Also, it is seen in my friend, this also, but still. Pelvic girdle or hip girdle connects hind limb skeleton with the axial skeleton, right? Lower bones. They unite posterior. It is made up of 2 hip bones called as the coxal bones. So you can see here the coxal bones, of course. So these are nothing but these are the coxal bones. Okay, ये जो है ना, आपको दिखाई दे रहा है बहुत अच्छी तरह से भी. Yeah, the butterfly shaped structure that you can actually see. Okay, so they are the coxal bones. Hip bones कहते हैं उनको. So each large irregularly shaped bone, the coxal bone, is made up of 3 parts: ilium, ischium, and pubis. So please, my dears, ये वाला पार्ट अच्छी तरह से समझ लेना. तो यहाँ पर भी आपको दिखाई देगा. So ये जो ब्राउन वाला पार्ट है, the largest part is ilium. This reddish part, pinkish reddish part, whatever, is ischium, and this yellow part is going to be the pubis. Okay, ilium, ischium, no, sorry, ये yellow wala is ilium, and this is the pubis. Pink wala is the pubis. So ilium, ischium, pubis. Ilium, ischium, pubis. Ilium, ischium, pubis. ठीक है? So this is in the pubic region. So this pink part is going to be called as the pubis. At the point of fusion of the three bones, a cavity called as acetabulum is present that forms ball and socket joint with the thigh bone. So rather than there, here it seems to be more specific. ये देखो, ये वाला दिखाई दे रहा है तुम्हें, ये cavity? This cavity? Yeah. So this cavity is going to be your cavity called as acetabulum for forming joint with the thigh bone. ठीक है? The two pubic bones are joined medially by cartilaginous joint called as pubic symphysis. तो ये blue color का part जो आपको दिखाई दे रहा है, this is pubic symphysis. Okay, fine. Pubis and ischium together form a ring of bone that encloses a space called as obturator foramen. तो यहाँ पर देखो, ये जो है, जहां पर मेरा फिंगर अभी बाहर निकल आ रहा है ना, you can see this. This is the obturator foramen, right? So the pubis and the ischium. So this is the pubis, pink wala. This is the ischium. It forms a cavity called as obturator foramen. Clear? Simple. Bones of the lower limb, just like अपना hand है, वैसे ही leg के बारे में बताया है उन्होंने. The thigh bone is the longest bone in the body. Yeah. The head is joined to a shaft at an angle by a short neck. It forms ball and socket joint with acetabulum cavity of the coxal bone. So acetabulum की cavity मैंने आपको दिखाई, उसके साथ ये thigh bone join होने वाला है. The lower 1/3 region of the shaft is triangular flattened area called as popliteal surface. Distal end has two condyles that articulate with tibia and fibula. So just like radius and ulna, we have got tibia and fibula. Patella is nothing but the knee bone. So it is also called as kneecap, which is a sesamoid bone. It is flat, rounded bone with pointed lower end. So यहाँ पर भी आपको दिखाई देगा, of course. See, this is the patella. Okay, this is the femur. This forms the thigh bone. Okay. Then let us go to each of them. Tibia and fibula, these are two long bones of the shank or lower leg, just like radius ulna, same दिखते हैं वो. They are connected to each other at the extremities, and between the two bones, again, interosseous membrane is going to be present. Tibia is much thicker and stronger than the fibula. Its broad and expanded upper end articulates with the femur. So just like how I have shown hand, वैसे ही है. Lower end articulates with talus, a tarsal bone. So tarsal means अपना foot के bones है वो. जैसा wrist होता है वैसा अपना tarsal भी होता है. I'll show you. मेरी bag उधर. एक मिनट, I'll get it. Here. So here you can see this. How it is? देखो, ये जो है ये फीमर है. ये फीमर में ये शेप देखो बेटा फीमर का, और ये शेप देखो अपने हैंड बोन का. सो ये क्लियर डिफरेंस दिखाई दे रहा है आपको. तो ये जो सर्कुलर पार्ट है, इट इज गोइंग टू बी फॉर्मिंग द बॉल एंड सॉकेट जॉइंट. ओके, और ये नीचे से देखो हाउ इट लुक, ऐसे दिखता है. टू फिट योर here you can see the kneecap. ये देखो, ये जो है ये kneecap है, right? तो ये जो है it will be like this. Got it? How it is going to be, right? So they are saying tibia जो है, tibia is much thicker and stronger. You can see the difference between the sizes of the two. This is the tibia. This is the fibula. So it is much stronger, thicker than the fibula. It is broad and expanded upper portion, which articulates with the femur. Just now I showed you the femur. Lower end articulates with the talus, which is a tarsal bone. So here you can see, ये जो है अपना, ये ऐसे फिट होता है अपना लेग. Can you see this? How perfectly it is fitting? ये देखो इस तरीके से. तो ये जो बोन है ना, ये वाला अपने फुट का, हाँ, इट इज द टैसल बोन, जिसके साथ ये आर्टिकुलेट होता है, जिसके साथ ये बिल्कुल फिट होता है. ओके, जिसकी वजह से हम हमारा फुट है वो ऊपर नीचे कर सकते हैं. राइट? Fibula is a long slender bone on the lateral side of tibia. So this is the long slender bone on the lateral side of tibia. Got it? Tarsus देखो. Separate है या नहीं है देखना पड़ेगा. Separate वाला नहीं है. Point. So this is going to be your tarsal. ये वाला part. This one. Foot region. Right? Yeah. These are the bones of the ankle. जहाँ anklet पहना जाता है, पायल पहनी जाती है. 7 tarsals are arranged in 3 rows. See, in wrist we have what? 4 carpals in 2 rows. Here 7 tarsals in 3 rows. तो वहाँ पर 8 है, यहाँ पर 7 है, हाँ? 2 proximal, 1 intermediate, and 4 distal. Now, here in the diagram also you can see 1, 2, 3, 4, 5, 6, 7 एक रो में है. ठीक है? Metatarsals, 5 metatarsal bones support the sole region of the foot. तो ये जो part है, ये जो है, this one, अपना sole region जो है, ये sole इधर होता है, right? The sole region is going to support the foot. Correct? Then, proximally they attach with the distal row of the tarsals. Distally, metatarsals articulate with the phalanges. So these are the phalanges. You can see over here, these are the phalanges. See, ये जो है, these are the phalanges. Correct? Phalanges are nothing but the bones of the fingers. Fine? Phalanges are the bones of the toes, except the big toe. Big toe means thumb actually. Okay. It has got 2 phalanges. Rest will all have 3 phalanges. So here also you can see very clearly 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1 and 2. So in the big toe we have got only 2. Rest everywhere we have got 3. Correct? Understood this very clearly, beta? Yeah. So this is about the skeleton ka limbs. Okay? So that's going to be your appendicular skeleton, axial skeleton. In detail we have seen. Okay? Any doubts in this? Any problem in understanding any point of this? Come on, tell me. कोई भी point नहीं समझाओ तो बोलो please. Clearly understood? So don't worry. I won't start with the joints today. नहीं तो इधर ही बात खत्म हो जाएगी. जितना गया है अंदर पूरा बाहर निकलेगा. Joints and disorders, 2 ही पार्ट रहते हैं अपने ये चैप्टर को कंप्लीट करने के लिए. So I won't start anything new. Actually, I was planning to complete this chapter today, but coincidentally Wednesday was Republic Day. So we couldn't have a class on that day, but no issues. In the next class, I'll complete this entire chapter. So locomotion chapter will be done in the next class. And today I'll stop. Okay? ज़्यादा bombarding नहीं करूँगी, ज़्यादा परेशान नहीं करूँगी. Fine. Chal. So yeah. Bye bye. See you all in the next class. Okay. Oh, that is inflammation of pancreas, beta. Inflammation of pancreas is pancreatitis. Okay, fine. So next class we'll complete this chapter as well. We'll be completing with this also. Okay. Chal. Bye. See you all. Yeah. I don't know what other roof. I really don't know.